Well, our focus on the top of this broadcast and our first debate is also about the emerging COVID situation in the country. As far as India's caseload is concerned, it's been over 4 lakh every single day, and today is the fourth consecutive day when over 4 lakh cases have been reported. Not just that, even the death toll is of major concern. Over 4,000 deaths were reported in just the last 24 hours. Now, if you look at these daily surges, and if you also take into account the 7-day average, you would realize there's some scope for improvement there, or there's a ray of hope, because the 7-day average tells you that there was a slight dip in the number of cases. Yes, there is a surge that continues, but there's a dip as well in the number of cases that are being reported. Not just that, in fact, the Union Health Minister has informed the country that in the last 1 week, almost 180 districts have not reported even a single case of corona. Experts also believe that the peak is here and we might soon see reduction in the number of corona cases that are being reported currently. Let's open this up and go across to our experts on the broadcast, and let's try and understand what do these numbers indicate at this point in time. We have Dr. Sitabhra Sinha, Professor, the Institute of Mathematical Sciences. We also have Dr. Dilip Mavlankar, Director, Indian Institute of Public Health, Gandhinagar, and Member Secretary, Gujarat State COVID Task Force. Good evening to both of you. I first want to go across to Dr. Sinha. Dr. Sinha, help us understand these numbers and the 7-day average that we are talking about that gives us a ray of hope that there is a dip that is also being witnessed.
Yeah, thank you. Yes, over the last couple of weeks, we have seen a somewhat slowing down of the pandemic. So, for example, between March 9th and April 21, when the pandemic was progressing, at the fastest pace, we had an effective reproduction number of about 1.3. So, let me remind the viewers that this number is essentially saying, on average, how many people are going to get infected by a single infected person. So, if the number is 2, that means each infected individual is going to infect on average about 2 other persons. So if this number becomes less than 1, that means the disease is no longer growing. You actually have the number of active cases increasing. So the closer this number comes to 1, that means the more it is slowing down in some sense. So as I said, at the peak, basically from March 9 to April 21, it was 1.3 for India as a whole, which decreased to 1.16 on April 24th, between April 24th and 30th. And then over the past week, it has come down further to 1.09. Now, this improvement is partly attributable to the improvement of the situation in Maharashtra, because Maharashtra contributes the largest number of active cases, and Maharashtra, we see actually the number of active cases going down. So from April 24th onwards, the effective reduction number for Maharashtra is actually less than 1. So essentially, you see the number of active cases gradually decreasing. But let me, put a word of caution here. The R value is still hovering close to 1. Currently, it's about 0.97. And if you consider that there's always some kind of error in doing this estimation, it's actually very close to 1. So it could reverse itself at any point of time. If we look at the next few states...
Dr. Sinha, thankfully, we have people like you who analyze these numbers and decode it for us. But if you could really break it down for the common man to understand, because there are just 2 questions that people really want an answer to. When are we going to see reduction? Are we already hitting peak? Is the peak near? Can you, based on the trend that you're witnessing, answer those questions?
Well, from the India-wide number, it might seem as if it's slowing down. And it is true that as you reach closer and closer to the peak, you would actually see the rate of growth of active cases slowing down. But I would say that we shouldn't rejoice too early, because if you break it down in terms of states, see, I've been talking mostly about India-wide averages. If you break it down in terms of states, it's a very mixed story. So, for example, Madhya Pradesh, which had, in its peak had an R value of about 1.35, recently went down to 0.92. And so, therefore, I would have thought that essentially, we have passed the peak and it would be downhill from then on. But over the last week, it has again risen to 1.22. So it's actually almost back to what it was in early April. Another good point is Chhattisgarh. So Chhattisgarh had been one of the states which was really making the headlines, and then it essentially also, like Maharashtra, started showing a downward trend. The number of active cases were going down. But again, over the last few days, it's shown a peak. The number of active cases going up. So while it's true that from April 24th onwards, several of the states are actually shown a much more reduced value of the effective production number, so that it would appear that the epidemic is slowing down somewhat. It is reversible. It is possible that the numbers would again start growing very fast. So we have to be very careful.
Absolutely. Basically the bottom line is it is going to take time. When you'd actually see the numbers going down to 5 digits, 4 digits, 3 digits, 2 digits, that day will also come. But for now, we have to follow the COVID appropriate behavior. Dr. Dilip Mavlankar, of course, people are going through all these reports, but one has to understand on an individual level that these numbers, the calculations, the analysis is all for projection of where we stand at this point in time, for projection of whether we've hit the peak or not. On an individual level, you cannot let your guards down.
Sure. I think that is very important message which you have given. The other message I want to give you is the peak of India is a sum total of maybe 300, 400, 500 peaks of different cities and districts. And as you see, state by state, there are some states which have peaked, some states are still going up, some states have started going down. So whenever the state like Maharashtra, which peaked or had large number of cases early on in April, has now reached its peak and going down. There are other states also in that. So there will be a trajectory. And some of the other states which are joining this fast increase at a later date will also peak at a later time. So that also we need to keep in mind. Second is we must also keep in mind these are peaks of reported cases. We don't know what is happening in unreported cases. How is the testing going down, up? The second part is the disease is spreading in many rural areas where the testing is even worse than what is available in the cities. So we may not be able to capture, even if cases are going up and even deaths are happening in rural areas, we may not be easily able to capture like before when it was concentrated in the cities. So those things have to be kept in mind and our guard has to be on. The other is we are not still publicizing hospital admissions, which is the sign of severe disease. Just a test positive may also mean very mild disease. But if we publicize every day how many hospitals admissions happen in each city, each state, then we will know whether hospital admissions are going down. Many foreign countries do that. And also the reporting of deaths.
Don't we have dashboards? Don't we have dashboards that give you real-time information? But yes, they only tell you about the beds that are vacant and available. Yeah.
Yeah. So new hospitalizations per day is a very critical parameter, which should be some states are giving, some states are not giving, some states are only giving ventilator numbers, saying so many on ventilator, etc., etc. So the more granular data you have, the more clear picture. And the death will peak at least 15 days to 21 days after the peak of the cases, because the death happens with a delay. So we may still see the death numbers going up. And that's why we have to be very, very careful.
Okay. Taking from where Dr. Mavlankar has left and a follow-up question along with that, Dr. Sinha, yes, what we are discussing at this point in time is all based on the official figures that we are getting from governments. Like he said, it's quite possible that the list is missing out all those people, who have not been taken into account by the government. Also, we should look into the fact that the virus is spreading rapidly in the rural pockets.
Absolutely. So, but this is a question that has been asked ever since the pandemic began, that how much can we trust the analysis given that this is, the actual numbers that are being reported are probably a gross underestimate. Now, let me point out that the effective reproduction number that I've been quoting is essentially a measure of the growth rate. And so therefore it is less resistant to underreporting than, for example, projections of actual case numbers. So if there's a underreporting factor of about 1 to 10, so let's say that out of the 10 COVID cases, only 1 is being reported. As long as this factor of underreporting is more or less consistent, the growth rate nevertheless can be stably estimated from the data, because the rate remains consistent, even though the actual numbers may change by any factor, for example. Now, let me also point out that there's often some doubts raised that could these could the decline that we are seeing currently in the rate of spreading of the disease be an artifact of the number of tests that are being done? So I was looking at essentially, what is the number of tests that have been conducted in the country as a whole and across individual states, and it seems to remain fairly steady. So, for example, India has been testing, on average, around 17 lakh people each day. Individual states also are fairly consistent. Like, for example, Uttar Pradesh, during this period, it has seen a very high peak in terms of the active number of cases, and then it's gradually currently coming down. But over this period, again, the number of tests that have been conducted has been roughly consistent around 2 lakhs per day. So if there's any artifact, probably it's not because of the variations in the number of tests. So, of course, like to point out that, the analysis, of course, is very much based upon the quality of the data, but probably it's not something as obvious as something like decrease in the number of tests, because that's remained fairly consistent.
All right, Dr. Mavlankar, also one other fact that I wanted to highlight was the information that came in from the Health Ministry. The Union Health Ministry said in the past 1 week, around 180 districts have not reported even a single case, and the dependency of critically ill patients on oxygen or on ventilators is going down. These of course are reports coming in from only those hospitals that are putting out real-time data.
Yeah. So that is also a good indication that the infection is at least stabilizing or declining in many areas. But when the ministry says there are no cases reported from those districts, they should also report how many tests were done in those districts, because some of the districts may be doing very, very little tests. The other thing which is missing is how many influenza-like illnesses are reported, because tests depend on influenza-like illnesses. So if there are influenza-like illnesses are increasing and tests are not happening, then we may be missing the cases. But tests are declining because influenza-like illness is declining, then we are happy that the cases are declining. So that metric is also not reported. What is also not reported is SARI, severe acute respiratory infection, which is a clearly defined WHO defined term, but whether testing has happened or not. So SARI is the precursor of hospitalization. So that also we need to have
absolutely.
Proper
couple of factors that we
that.
need to keep into check, couple of factors that we need to work on. We can't lose our grip at this point in time. I think that's the biggest takeaway. And on an individual level, for people of the country, for the citizens of the country, the authorities are doing their jobs. Mathematicians are analyzing the data that is coming in, but for you it's important to follow COVID appropriate behavior and to take all precautions. Thank you very much, Dr. Sinha and Dr. Mavlankar, for joining us on the broadcast and taking all the questions.
The News Hour Special Edition.